Welcome to The Doctor Will Hear You Now, a podcast featuring our physicians and other healthcare providers telling their stories, sharing glimpses into their daily work and mission, and showing what it means to practice medicine just a little bit differently.
Healing you means hearing you. Let's talk. I'm Lexi.
And I'm Ben, and today we're welcoming registered dietitian Brooke Kanigoswki with Our Lady of the Angels Health.
Brooke spoke with us about all things insulin resistance and diabetes. And as we continue our conversation on weight management, we know metabolism plays such a big role in that. And so Brooke shared with us really interesting insights about lifestyle and genetic factors that can contribute to insulin resistance and diabetes. And what she shared was kind of surprising.
Yeah, she had a really great perspective and approach to her work. She talked about understanding what works best for each patient might be different from another one. And that you should really focus on what you can do more of rather than what you should take away or what you shouldn't do. I thought she did a really great job at explaining in very simple terms how things like your fiber intake, how you stay hydrated, how all of those things work together in relation with keeping a healthy lifestyle. So we're really excited for everyone to hear what she has to say. Are you ready, Lexi?
I'm ready. Let's dive in.
Well, welcome, Brooke. Thanks for joining us on the podcast today to talk about all things insulin resistance and diabetes. We're glad to have you.
Yeah, thank you so much for having me. Glad to be here.
Of course. And so today's episode is part of a series that we're doing about weight management. And we know metabolism plays such a big role in that. So we're so glad you're here to talk with us about it. Wanted to start just by learning a little bit more about you. If you can tell us more about yourself and your work at Our Lady of the Angels.
Sure. So I'm a registered dietitian, and I've been practicing for over 20 years now. And throughout my career, I've been able to work in different fields of dietetics. So I've worked in the clinical field. I've worked in long-term care. I've done some food service management. I've had the opportunity to work with our veterans at the Veterans Affairs, which was a very unique and special opportunity for me. But now I am the outpatient dietitian over at Our Lady of Angels system. So I see patients on a one-to-one basis, or even with their family members, whomever, has a hand in grocery shopping and meal prep and cooking. So it definitely has families sometimes, but I help patients who have certain health goals or certain health conditions, help manage those conditions through their diet, through their lifestyle factors. So we really sit down one-on-one, kind of see what people are eating now, what's the usual routine for you, and then try to mold and change and figure out what works best to help them reach those health goals and manage whatever condition it is they're working on. So I see a lot of patients with diabetes. I see a lot of weight management patients, and I also see a lot of people who are undergoing or working up to get weight loss surgery. So we talk a lot about those pre and post diet changes that have to happen. And it's super fun. I love it.
Yeah, it sounds great. I mean, such a valuable resource to offer patients. And so I'm sure they're glad to have you help navigate that for them. Or with them, And so I'm curious what a typical day in the life looks like for you. Is there a typical day for you in a clinic?
Right. It can be different for sure. But mostly I see, my appointments are usually about an hour long. So I'll see a patient for about an hour so that we can really kind of drill down and I ask a lot of questions to kind of see what it is somebody is doing now, and so that we can sort of tweak and change things to help with their specific goals. So I see a lot of patients, both in person in my office, but I also do some virtual and over the phone appointments as well.
Can you explain, I guess, the difference between insulin resistance and diabetes for us, type 1 and type 2, and also maybe how common these two conditions are in the populations that you see?
Yeah, that's a good question. So we'll start with insulin resistance. Like, what is that? We probably hear a lot about it on social media and, kind of all over, people talking about I'm insulin resistant. What does that mean? So insulin resistance is a condition throughout the body where your cells become resistant to insulin. Insulin is a hormone that's produced by our pancreas, and it has a number of roles, but one of its primary roles is to help regulate our blood glucose. So when we eat a meal that has a lot of carbohydrates, specifically refined processed carbohydrates and sugars, those foods digest very rapidly into glucose. And so we have a lot of circulating glucose in high levels, and our body does not want those high levels of glucose. So insulin's role, when it notices we have a lot of glucose in the system, the body signals the pancreas to make that insulin, and insulin's role is to help get that glucose out of our bloodstream and into our cells where it can be used for energy or stored for later use. So over time, if you're eating a diet high in refined carbs and sugars, or there are various other factors that can affect this as well, but when you have these higher levels of blood glucose, your body's producing this insulin kind of over and over. It's this cycle, and your cells can become resistant to that insulin. So it's not working as efficiently as maybe it once would. So your body's having to produce even more insulin to help get that sugar out of your bloodstream and into the cells where it can be used for energy. So with insulin resistance, you may not actually know that you have insulin resistance because there's sometimes not even signs or symptoms that you have it. With diabetes, first let's separate type 1 and type 2 because they're very different. Type 1 diabetes is an autoimmune condition where the body's immune system will attack the cells in the pancreas that produce insulin. So if you have type 1 diabetes, you are not making insulin or you're making very little of it. And so you have to take insulin therapy every day to help manage those blood sugars. So type 1 diabetes is generally diagnosed when you're younger, not always, but usually. On the other hand, type 2 diabetes is more dealing with insulin resistance. So with type 2 diabetes, you maybe have been insulin resistant for a while, and over time, if you're consistently eating a diet high in those refined carbs and sugars, you're elevating your blood glucose levels, your body's producing that insulin, but your cells become so resistant that it's no longer able to produce enough insulin to help lower those blood sugars to normal levels. So by the time you are diagnosed with diabetes, type 2 diabetes, you generally also need medications to help you manage and lower those blood glucose levels to a normal level. So that's kind of the difference.
Oh, that's helpful. And so I'm curious, just as a follow-up question, if you are insulin resistant and you are diagnosed with that condition, is that just like, okay, it's only a matter of time until you're type 2 diabetic? Or is there a way, or is that, it's not guaranteed, right? If you change lifestyle or you focus on treatments, I'm curious on your thoughts there.
You might not even know, like I said before, that you're insulin resistant. A very large population or percentage of our population, I don't know the exact number off the top of my head, may be insulin resistant and not even know it. And it's not guaranteed that your insulin resistance will cause diabetes. There's a lot of factors that go into that. And I don't think we have all of the specific answers as to why it occurs, but we do know that there are contributing factors and risk factors that can increase your risk. So one being just genetics. Do you have a family history of type 2 diabetes? If yes, then it may mean you're at higher risk of being insulin resistant. We know certain ethnicities also are at higher risk of having diabetes and insulin resistance. So it's not, just one particular thing. But besides our genetics that we don't have any control over, it's also our environment. So our environment can play a big factor in if we develop certain conditions or not. So as a dietitian, I mainly focus on what is your diet like? Do you have a poor quality diet? Are you overweight? Because we know obesity can be a risk factor for insulin resistance or diabetes. What are your activity levels? Are you very sedentary? Or are you really active? So these things we can talk about a little bit more in detail later, but it's also other risk factors, things that we might not think of that can be contributing, like our sleep. Good quality sleep is so important. And, are you sleeping 7 to 9 hours of good quality of sleep every night? If you're not, do you have sleep apnea, or do you have other reasons that you have trouble sleeping? if we are chronically sleep deprived and we're not getting that good quality sleep, that is stressful for our body. And when our body is stressed, we produce a hormone called cortisol. And cortisol, it's kind of like fight or flight, right? And cortisol will naturally make our bodies produce glucose. It will elevate our glucose level so that we can be ready to fight or run, right? And so when we have those elevated glucose levels, we know that signals our pancreas to produce that insulin. And then so if you're chronically sleep deprived, you kind of have this cycle of high blood sugars, and then your body has to produce that insulin to try to get that glucose out of the bloodstream and into the cell. And so over time, that can be a big risk factor. Other than like good sleep, stress, stress management is really, really important. And it's not to say like avoid stress, right? Like we know that's not possible, right?
That's life, right?
The one
it's
thing
so
in
hard.
life we can count on is there will be stressful situations, but how are you managing that stress, or are you not managing that stress? Is when your body is stressed, we create that cortisol, which creates high levels of blood sugar, which then creates the cycle of releasing the insulin. And then you become a higher risk of being resistant to that insulin because it's always there, and your cells just kind of turn off that signal because it's always seeing this insulin. So it just kind of shuts it down. So your body has to produce more and more and more of that insulin to do the same work. And over time, this can just lead to certain conditions.
Yeah, I'm curious about that of what are those long-term complications, especially if untreated. So I know you mentioned that most of the population may have it and don't even realize it.
Don't even know
and
it.
so I'm just curious, are there long-term complications with insulin resistance if left unnoticed, untreated, or?
Yeah, so there are a variety of conditions that could be potentially linked to insulin resistance. So I kind of like to think of it as almost like a tree, right? So the tree has all these branches where you can have all these different medical conditions, and the roots are like the root causes, what is causing it. For a very large variety of conditions, down in that root system could possibly potentially be insulin resistance as a potential risk factor for those. So, and then how it manifests is just up to your own personal genetics and lifestyle and how your own body, manifests that condition. Insulin resistance has been linked to things like cardiovascular disease, so heart attacks and strokes. It's been linked to high cholesterol levels, high triglyceride levels, fatty liver. Even some, brain health. So some forms of dementia have been linked to insulin resistance. Also infertility, so things like PCOS or polycystic ovarian syndrome can all be linked potentially to having this insulin resistance. And then obviously, it can also turn into, if left unmanaged, and over time lead to prediabetes or diabetes. And we didn't define prediabetes earlier, but essentially prediabetes is when your blood sugar levels are above normal ranges, but not high enough to be diagnosed as diabetes. So a multitude of conditions can be contributed from insulin resistance.
Well, I'm glad you clarified that because that was going to be a follow-up of insulin resistance is its own thing, and it doesn't mean you're pre-diabetic.
Correct.
And pre-diabetic is kind of its own thing, and then, of course, being diabetic.
Right.
Okay, that's helpful.
Good. Well, I was just going to say, and then if you have diabetes, and, when you have diabetes, your body is not able to keep up with the insulin needs because your cells are so resistant. So you have high blood sugars. And so you definitely need work with your provider on medication management and diet and lifestyle and all these things. But if you chronically have high blood sugars, our body does not like that. It's very stressful for our body. So when you have diabetes and it is unmanaged and uncontrolled, over time, you increase your risk of damaging systems of the body, damaging organs. So things like your eyes, your kidneys, your nerves, the circulation in your blood. If you have a wound, it makes it really difficult to heal if you have these chronically high blood sugars.
So from what I'm hearing, I'm kind of curious when we're talking about resistance and cells being resistant to insulin. Like, does that mean that you sort of reach a threshold and you can't come back from that? Like, can they sort of reset in a way?
Yes, absolutely. Absolutely. Through various factors and various lifestyle changes, you can improve the sensitivity of your cells. Absolutely. Which can help control your blood sugars. Absolutely. These things can happen. So I always encourage people, whether you have a certain condition, right? And have already been diagnosed, by making some of these lifestyle changes, you can help manage that condition. If you have not been diagnosed with something yet, and maybe you suspect that you might be insulin resistant, you can always start these healthier lifestyle changes and working on improving your sleep, improving the way you manage your stress, improving your diet, improving your exercise. So all these things can help you be improved. And these are the things that people should be doing regardless if you have a condition or not. Like, these are preventative things that we can all be working on to help, stay as healthy for as long as possible.
Yeah, that's great. I'm curious too, because I know you said sometimes you may not experience symptoms, but you may have a feeling that you might be insulin resistant. And of course, the chatter online, it's everywhere on TikTok and Instagram. And so what are some of those, I guess, what can people look out for if they have a feeling? What are maybe some of the things that they may be experiencing? How do you know when you should bring it up to a dietitian or your provider?
Yeah, so
to start figuring out
what's going on, right?
Yeah.
So just first of all, overall looking at your lifestyle, see if there's some things that we can manage a little bit better. But if you're constantly having like cravings, or you feel like you're just hungry all the time, if you're having trouble losing weight, and I have a lot of times people tell me, especially as we get older, I'm doing everything the same thing. I'm eating the same way I always have. I'm as active as I always have, but I'm really, really struggling to lose weight, right? Or I'm gaining weight. So all of these things can be little indicators that maybe something else is going on. So we know that overweight or obesity is a contributing factor or a risk factor for insulin resistance. But at the same time, insulin resistance can make it can cause you to gain weight, right? So it's just one of these, it's really confusing, right? And I also want to say, just because you're overweight or obese does not mean necessarily that you have insulin resistance. And you can be a normal weight or considered a normal weight, not overweight, and have insulin resistance. So just because you're a normal weight does not mean that you do not have it. And just because you're overweight does not mean that you have it, right? It just can be, these are risk factors. So you kind of have to look at all of the other things that are going on. But if you are overweight, we know that even the smallest amount of weight loss can make big improvements in the sensitivity of your cells. Even the smallest amount of weight loss can help improve your glucose levels. So if you're overweight and you don't have to lose 60 pounds or whatever it is and you think that you have to lose, even just 5 to 10% of your total weight loss can be helpful. So what that means is, let's say you're a shorter stature person and you're 240 pounds and you're overweight, so you know you need to lose weight. 5% of 240 pounds is 12 pounds. You can start with just that small 12-pound loss. And we know that if you can get there, then that can show really great improvements on, reducing the resistance of your cells and improving your blood sugars.
So if someone, let's say a patient comes to you and they have been diagnosed with insulin resistance, and you've kind of already shared about how it's like this chicken and the egg situation, right? Where if you have it, it's really hard to lose weight, but losing weight is what's going to help. And so I'm curious on, like, what are these special things that someone can do if they are insulin resistant, and it's a little bit working against them, right, in their weight loss goals and trying to get better. So is there a specific diet? Is there a specific plan? I've seen things all over the place about eating certain foods in a specific order, right? Like your fibers first, then your proteins, and then your carbs, all of those tips and tricks. I mean, is there any validity to that? And are there things that they can be doing in this kind of what seems like it's an uphill climb, really, in what is what it sounds like?
Yeah, absolutely. So you're right in this uphill climb. And I have people that come to me every single day and they are so frustrated because they feel like they have tried every diet under the sun to lose weight. And maybe it worked for a little bit and then it no longer works, or it just didn't work at all. You're just completely frustrated, right? And you see all these things on the internet or on social media to eat this, don't eat that, this is bad, this is good, and it's just not working. So just to preface all of that with saying there is no one perfect diet for every single individual on the planet. So we are all uniquely ourselves. We have different genetics. We have different likes and dislikes and predispositions. So that's why it's really important, if you have the opportunity to sit down with a provider, sit down with a registered dietitian and look at what you are doing now and try to come up with a plan that's unique for you. But I also want to say that it is so frustrating because there are factors that work against you. If you are overweight or have insulin resistance, there are factors that kind of work against you, like I said before, like insulin resistance can lead to weight gain and obesity is a risk factor for insulin resistance. So like, where do we go? But I think it's important to kind of understand what is happening. And once you kind of understand that, it helps you make better and more informed choices. So we know that when we have a lot of insulin in our system. So our body is having to produce more and more insulin because our cells are resistant to bring those blood sugars down to normal. Insulin not only is a hormone that helps regulate our blood sugars, it also helps our cells or dictates to our cells what to do with the energy that it receives. So when we have high levels of insulin, that insulin is telling our cell to promote fat storage. So any energy that's coming in, the body is saying, store that as fat. So at the same time you're storing that as fat, it's inhibiting the body from breaking down fat cells for energy, right? So when we have high levels of insulin, our body is promoting that fat storage. So that can make weight loss difficult. We also know that if our blood sugars are high, and we have chronically high blood sugars make us feel hungry, right? And we have cravings, that we usually crave more carbohydrate foods. And the reason that is happening is because we have all this energy floating around, or all this glucose floating around in our bloodstream, but we can't get it into our cell because our cell is resistant to that insulin. So our cells are hungry. Our cells feel like they're starving. It can't get that energy. So it's sending those signals to your brain that you're hungry. So that we often overeat, which further makes it difficult to lose weight. Also, what's kind of going on is we have a lot of hormones in our body, a lot of hormones that help regulate our hunger or help suppress our appetite. And especially in the setting of obesity and high insulin levels, this can dysregulate those hormones and really cross those signals to where it makes it even more difficult to manage our hunger levels. So it's not just about like your willpower to not eat that cookie that's staring at you. There are physiological and hormonal things that are going on that make it hard. So diet is very, very, very important. What are you eating? Are you eating a diet high in those refined and processed carbs and sugars? We know that those types of foods convert to glucose very rapidly and then send that glucose really rapidly into our system. And so that is kind of what we want to avoid, because those high blood sugar levels make us have those cravings. So what I mean by refined or processed carbohydrates and sugars are any foods that have a lot of sugar in them. So a lot of our sweets, our cakes, our cookies, our pies, our pastries, our ice cream, those types of things. A lot of our white refined bread, noodles, white crackers, rice, these foods digest very, very quickly. A lot of our sugary beverages is that's where I always, the first thing we look at is, what are you drinking? Are you drinking a lot of sodas? Are you drinking a lot of fruit juice? Are you drinking a lot of sweet tea or energy beverages or sports drinks? How many of us get that really sugary coffee in the morning, right? Because we need that energy. But what can happen if you get that sugary coffee first thing in the morning, that sugar and that coffee, spikes those blood sugars. And when our blood sugars are high, then we get these cravings and hunger. And so it kind of sets you up for failure for the rest of the day. So it's not only trying to limit those foods. It's not to say you can never eat chocolate again. It's just how often, how much, and in what combinations are you eating these foods. So it's important to kind of understand that. And what I like to do is not so much talk about what you should not be eating, because the minute you tell me I can't have something, that's all I can think about wanting, right? So I always try to think about what should you be eating to help you feel full and satisfied and have energy. So are you eating enough protein? Are you getting those lean proteins? Protein not only helps you build muscle, but it also helps you feel full and satisfied for longer. Are you eating enough fiber? I would say in general, as a society, we do not eat enough fiber. And fiber is so important because it can help you feel full as well. It adds a lot of volume to your meal, which is important. But fiber also takes a long time to break down. So if you're eating fiber that also has carbohydrates, it slows the release of that glucose into your system. So you don't have those big spikes. You just kind of have a slow, steady stream, which is what you want. So fiber foods is going to be any of our vegetables, right? Any of our non-starchy vegetables, our broccoli, our carrots, our tomatoes, our bell peppers, our onions, our zucchinis, and we could just go on and on, right? It's also our whole grains. So your whole grain bread, your whole grain pastas, your oats, your quinoa, those types of foods. And then honestly, fruit. Fruit is very, very important. Fruit has tons of vitamins and minerals and antioxidants and phytochemicals in it that are important. So although your whole grains and your fruit has carbohydrates, it's also packaged with a lot of fiber. So it slows down the release of those sugars. Are you eating healthy fats? Are you getting avocado and olives and olive oil and these types of foods, nuts and seeds? These are all very satiating foods that do not spike your blood sugars. So I like to focus on like what should you be eating, not so much as what you should be avoiding. And I find that if you try to do that, you feel full and satisfied and you don't have all of these cravings that you would if you just constantly were eating those high sugar foods throughout the day.
That's a good point. Because I heard what you were saying earlier about your body's starting to kind of crave that carbohydrate fix.
Mm-hmm.
And so we tend to go for the easiest option, which is that hamburger or fried food or something that's just going to give us that quick fix. So it's good to think about what those alternatives are that are going to still make you feel full. So you can continue with your day and not be so worried about filling up.
Right.
I was curious too, because you mentioned energy drinks, and this is something that I struggle with sometimes too, is that you reach for something that positions itself to be sugar-free. And so you're like, okay, that's gonna help. It's sugar-free. But then there's like these artificial or substitute sweeteners in there that can be just as bad, I guess, for you and for your...
Not necessarily, no.
Okay.
Especially if you have diabetes and you're really trying to control your blood sugar, which means you are trying to control the amount of sugar or amount of carbohydrate that you're taking in a day. If you want to substitute a regular sugar for a sugar substitute, you absolutely can do that. There is no sugar in that sugar substitute, right? So for some people, it can be a really, really great switch and a really helpful switch. Yeah. So I think if you're used to drinking sugary beverages and you have trouble switching those over to just water, a good switch would be a sugar-free version of that same drink. That's a great place to start.
Yeah, so kind of managing the not going cold turkey, right? Because that's really hard to do, but kind of managing that slow rollout of the lifestyle changes.
Exactly. I usually tell people pick one thing to work on and do that one thing for a couple of weeks until it no longer seems super hard, right? And then you can pick another thing. Nobody's perfect and nobody expects you to be perfect. It's just a matter of doing what you can and being mindful of it, for sure. The timing of your meals is also really important. In general, when we want to manage our blood glucose levels, it's a good idea to kind of eat evenly spaced out throughout the day. That's not for everybody. Some people have a very difficult time eating breakfast, so it doesn't mean you have to eat breakfast. But typically, when we go all day without eating, and at the end of the day, we are starving and we end up overeating, and then we sit down and we go to sleep, right? In general, that's not really helpful to kind of balance out those blood glucose levels. So timing is important. Another really important thing is hydration. And we were just talking about energy drinks or just drinks in general. Getting adequate hydration is very, very, very important. Our fat cells hold on, they're kind of combined with water. water molecules. So if we are chronically dehydrated, our body doesn't want to give up that fat cell because it's a source of hydration for it. So having adequate fluid every day can help your body kind of get rid of those fat cells when it's time. And especially in the summer. Yeah, in the summer here, or even in the winter, we typically don't drink enough fluid. So that's an important thing to think of.
Yeah, that's what I was going to follow up to that is there a rule of thumb on how much water you should be drinking? I've heard it tossed around like half your body weight in ounces of water a day. Is that a real thing?
It's a real thing, yeah. It's very dependent on the individual, right? But that's a good place to start. Half of your weight in ounces of fluid per day. And then from there, it'll be how much are you sweating, how active are you, how humid it is outside. So, but that's a good rule of thumb to start with, yeah.
Oh, good. Well, the humidity here, then it's pretty high. So in the South, everyone should consider that for sure.
For sure. Yeah, definitely.
Well, and I guess I'm sure you get this question a lot in just your patients that you see and interact with, but it's been a hot topic online and just everywhere, buzzwords. I'm curious about medication options to manage insulin resistance and diabetes, the metformins, those semaglutides. Can you tell us a little bit about those? And I'm just interested, I'm curious kind of in your thoughts there.
Yeah, sure. So I do not prescribe medications, but there definitely are a lot of options out there now that can be really, really helpful, especially if your lifestyle changes aren't bringing those blood glucose levels down, right? So between oral medications like metformin, that's usually kind of the first one. If you're pre-diabetic or early diabetic, that's the first one that you will see added usually. But there's also injectables and then obviously insulin therapy. So that would just be something to talk to your doctor about because it would be unique to your own circumstances and what your conditions are. But some of these medications can help with weight loss as well. They can help slow the digestion of your food. So you feel full and satisfied for longer. And so that helps reduce your hunger. So there's a lot of different options out there. And that would be if you're just still struggling with those cravings and that hunger and you're still struggling to have weight loss and your blood sugars are elevated, to definitely talk to your provider about.
Any, I guess, myths or misconceptions that we might not have discussed yet about diabetes and insulin resistance that you would want to debunk for us today?
Sure. So how long do we have? There's a lot. I would just say a couple. One, like I said before, there's no one perfect diet. So just because you see online that something worked for someone else does not necessarily mean that it's going to work for you, right? So that's one. Two, the dreaded scale. So I see a lot of times people are working on weight loss and they weigh themselves and they feel like they're really, really working hard. But that scale they didn't lose as much on that scale or they gained a pound. And that's completely frustrating and then they just give up. So I always try to tell people the scale is not really the best indicator of if we're being successful with our diet changes and our exercise. Fluid is very, very heavy. So if we're really restricting ourselves up front, we can lose a lot of fluid very quickly. And you can see those big dramatic changes in our weight. Conversely, if maybe the day before you ate something that had a lot of salt in it, a lot of sodium in it, or you ate a high carb meal, those things retain fluid. So you might see your weight jump up, even though you feel like you're restricting yourself. So the scale is not the best indicator. But what we want is over time, a 0.5 pound to 2 pounds of weight loss is a good realistic rate of weight loss if you're really working on it. And we don't want these drastic changes because if we have these drastic changes, one, you're probably being really restrictive with what you're eating. And we know that if you're really restrictive, that can't last forever. So eventually you're going to go back to eating the way you were, and then you can have that rebound weight gain. And usually it's plus more than you were before, which can be super frustrating. So slow and steady, really win the race when it comes to that. And also, you try not to weigh yourself every day. If the scale is stressful for you, then just don't do that, right? You can, measure how you're feeling. How are your clothes fitting? You can measure your arm, your thighs, your waist circumference. There are other indicators to if you're being successful, not just the scale. And we want to stay away from those really big, quick, rapid changes, and slow and steady really wins the race when it comes to that.
That's great. It's focusing on those non-scale victories. It's growing a bike, and it's also, can I walk farther this time, or am I running more?
Exactly.
Those positive things to look for. I'm curious. You said that kind of 1/2 pound to 2 pound, is that, what's normal? Is that weight loss
that
per
would be
week, per month,
per week? So 1/2
week.
pound to 2 pounds per week would be a really good rate of weight loss goal. Yeah, that's a great place to start. And just to know that you're going to have plateaus and you're going to have fluctuations, but we kind of over time, we want that to be, those fluctuations to be moving in the right direction.
Yeah, I get that. That's really helpful. And I'm curious too, with all of this, you've explained a lot for us, and I think that it's probably overwhelming for a lot of people, and it was scary. And I'm curious, what's your advice for someone who's maybe just getting started with this journey, or maybe doesn't even know that this is their journey and that they could have this, right? But they know something is off.
Yeah.
What advice would you give to them?
Sure, to listen to yourself. Like if you feel like something's not right, then you listen to yourself, right? And just look at your overall, circumstance, right? We don't have control over some things, but we do have control over the foods that we're eating. We do have control over maybe our exercise levels. Sorry, this popped out. So just to pick, like I said before, one thing. So if you feel like you're drinking too many sodas, right? If you're drinking 3 sodas a day, start with just trying to do 2 sodas a day and do that other one with a water, right? So it doesn't have to be these big drastic changes. Small steps become easier to do. And then as you add in those small little steps, you can be successful. So nothing is going to happen overnight. This is a lifelong journey. And we always want quick results, but I try to tell people that's not realistic. We typically didn't get in the situation we're at overnight, so we're not going to get out of it overnight. So it takes time. We also didn't really talk about physical activity, because that is actually one place that a lot of us, can make some improvements with. We know that the more we exercise, the more sensitive our cells can become to that insulin. Exercise takes a lot of energy. So if we have those high levels of glucose, increasing our exercise can use up that energy. So, again, muscle is very, very important. So that strength training, I think we don't hear enough about, is, using all the major muscle groups. It's that kind of use it or lose it type of thing. Our muscles are almost like sponges, and they soak up that glucose. So the more muscle you have, the more glucose you can fill it up with. I like to kind of say that our muscles are like a garage. If the bigger your garage, the more cars you can fit in that garage before they start spilling out into the street. Our muscles are like a garage. The more muscles we have, the more glucose we can fill it up with before it starts spilling over into our fat cells. So the goal with resistance training or any kind of strength training is 2 days a week, and if you're somebody that has not done any training at all, you can start really, really small. Those resistance bands, if you've ever been to physical therapy, you've probably seen those bands, right? That's a great place to start. You can get those. Watch a YouTube video about resistance bands exercises and sit in your living room and do it. You do not have to go to a gym to exercise. It's awesome if you have that ability, but you do not have to, right? And then that cardiovascular activity is very important, where we elevate our heart rate for a little bit. That can be things like walking, biking, stationary bike, swimming, dancing. These are all very important activities that help elevate our heart rate. Our heart is a muscle, so we can strengthen our heart, but it also burns glucose. So at minimum, I try to tell people after you eat a meal, go for a walk, right? Especially if you think about what's the largest meal of your day. Usually the evening meal is most people's largest meal of the day. If you can go for a walk after you eat that meal, even for 5 or 10 minutes, we know that helps use some of that energy that you just ate, use some of that glucose, and can help prevent these big rapid spikes in your glucose. So exercise in any form that you can do it is beneficial. If you have limitations, maybe you have a bad back, a bad knee, you can sit in a chair and do exercises. So there is a way to do it. It might not look like with what you could do when you were in high school, but to just move in any way that you can is very, very, very beneficial to help regulate your blood sugars and help reduce your risk of insulin resistance.
And it also sounds like I'm hearing that if I get into weightlifting, I can like eat more dessert, is what you're telling me.
The more muscle you have, the more you can eat, right? Muscle requires a lot of energy. So, the more muscle we have, the more we could eat. Absolutely.
I love that flexibility there. And I love that you said, it doesn't have to be that 0 to 100.
Yeah.
It's what you can do. You don't have to run. You can walk. You can sit and move, or just that 5 minutes after you eat, walking. It's those little things that add up, and doesn't have to be, okay, I'm sedentary and now I'm going to 100 miles an hour running every day,
right?
Going hard,
I'm going to go to the gym and run 2 miles every day. Like, you don't have to do that. You just start where you're at and pick one little thing to work on and get that down before you move on to the next. Absolutely.
That's great. Well, to switch gears a little bit, we always ask our guests, it's a fun question. It's probably one of my favorite questions we ask every time. But because we are the health system that listens, we're always curious about what you've been listening to lately. And it could be, is it, professional podcast, music, it could be fun things, topics, TV shows, whatever. Just curious, what's on your playlist?
Oh my gosh. So I don't know that I have specifics, but I love listening to podcasts, whether it be professional things or just fun, like using comedians or something that I can laugh at on my way to work. I have quite a drive, so it's nice to listen to those podcasts. And I try to mix it up. I don't, it's nice to learn, but it's also nice to have like something that's funny or just kind of, you can just listen to and not think too deeply about. So I would say just a variety of things. I can't think of any like specific thing off the top of my head, but I'm a podcast girl. So when I work out, I also listen to podcasts.
I was wondering, we kind of touched on this earlier, but with the patients that you see, how long does that relationship go on for you with those patients? Like, how often are they seeing you? Like,
that's a good question. So it all depends. Sometimes it's just one time and they feel like they've got the information they need to move on. Other times I'll see them usually once a month or every 2 months. Until they feel like they can manage these things and they've got a good grasp of what they should be doing and feel confident in doing it. So it's different for everybody. Yeah. Sometimes it's just once, other times it's once a month, other times it's once every 2 months. But I've seen some people for over a year now, just periodically, just to kind of check in.
Yeah. And like you said, the slow and steady wins the race. So they kind of have to expect to continue that relationship for a while before they can start seeing results.
Yeah, exactly.
I'm curious, how does listening play a role in your practice? Because I would assume people probably come to you very frustrated, or they're kind of out of hope, or they're lost, or they're just really upset and sad, or, a myriad of emotions that they're feeling. And so I'm curious, I'm sure you have to kind of listen for some of the things unspoken and approach those conversations really sensitively.
Yeah, that's such a great question. And it's so true. And I love what I do because I have the time to sit and listen. Like, so I get a good solid hour with an individual, and that just gives us the time to really listen to what their concerns are. And I try to take it, okay, you've tried this many diets, right? This is frustrating. So let's start over. Let's start the basics. Let's start things that maybe you haven't thought about before, right? Or, some people do not like to eat breakfast. Some people do not like certain foods. And so I'm not going to tell you to eat that food, even though I know that it might be really good for you if you do not like it, right? So it's just taking into account people's personal preferences, taking into account the things that they've tried in the past that didn't work, and maybe, just trying something new. But you're absolutely right. That's what I do for the first part of when I first meet someone, is just have them talk to me about what they're trying to do, what they've done in the past, what they're doing now, so I can get a good idea of kind of their mindset, of where they're at, what they understand, what maybe they don't understand, and kind of start from what their particular needs are, versus just saying, here's the diet, follow that, right? That never works. So I try to meet people where they're at and to work with the parameters that they fall into.
Well, thank you again for joining us, Brooke. It's been so great to hear from you and hear your expertise. And we really appreciate you talking us through something that is so complex and so confusing for a lot of people. And so appreciate you sharing your time with us.
Absolutely. Thank you so much for having me. And thank you for asking me to do this. And I just want to let people know you are not alone. And our health journey is not easy, and it's not something that takes a week. It is a lifetime of constantly working to improve ourselves and work on those things that can help us be healthy and live a long, happy lifestyle. So if you have the option or the opportunity to speak with your provider and you have a dietitian in your system and you think that that would be helpful to sit down with somebody one-on-one and really kind of get to the crux of what can help you be successful with your health goals, you should do it.
That's great. Thank you so much.
Absolutely. Thank you.
And listeners, thanks for tuning in. We'll have everything Brooke mentioned and other helpful resources linked in the show notes. We'll be back soon with more episodes of The Doctor Will Hear You Now, a podcast from Franciscan Missionaries of Our Lady Health System.
And if you have ideas for topics you'd like to hear on the show, just email us at podcast@fmolhs.org. Thanks for listening.